Good afternoon. I'd like to call the Committee on Public Health and Human Services to order. Recognize that we have a quorum in the presence of Councilman Dennis O'Brien, Councilman Greenlee, Councilwoman Keona Sanchez, and myself. We'd like to have the clerk read the bill for the record. Thank you.
Bill number 140095, an ordinance amending Chapter 10-600 of the Philadelphia Code entitled Public Places Prohibited Conduct by adding a new section to prohibit the use of electronic smoking devices in public places and in the workplace under certain terms and conditions. Bill number 140096, an ordinance amending Chapter 9-600 of the Philadelphia Code entitled Service and Other Businesses by clarifying penalties for violations of Section 9-622 entitled Cigarettes and Tobacco Products, and by adding a new section to prohibit sales of electronic smoking devices and unapproved nicotine delivery products to minors under certain terms and conditions.
Thank you very much. Before we begin our public testimony, I'd like to call on Councilman Greenlee for some remarks.
Thank you, Madam Chair, and thank you for calling this hearing. First, I want to recognize the efforts of former Councilman Green and his staff members, Allison Perlman and Haji Malumian, for their efforts on this issue. Councilman Green introduced the first bill dealing with this issue. I also certainly want to recognize my legislative director, Noel Marconi, who first raised this issue with me and has done extensive research and work on it. There are two bills before us, this committee today, that deal with electronic cigarettes. One, which I don't believe will, or at least it should not, generate much opposition, except for maybe some dispute on language, will ban sale of e-cigarettes to minors. I think it just makes common sense to not let kids be able to obtain a product which, quite frankly, we don't know a lot about. And that brings us to the second bill, which would regulate, not ban, regulate electronic cigarette uses, particularly in public places. The opponents of this bill will say, we don't know enough about this product, so don't implement any regulations until we do. Well, respectfully, I say the fact that we don't know enough about this product, by the way, that's totally unregulated product to this day, is the reason we should have these regulations. Various ingredients can be put into electronic cigarettes, and right now we don't know what they are, and we don't know what effect they may have. So I say let's err on the side of caution and put in place what I believe are reasonable restrictions. You'll hear from our health commissioner, Dr. Schwartz, former commissioner, Dr. Su, and a couple of other professionals who will tell better than I can that at least we have potential risks of these products. And may I add, I could bring a lot more people in here to testify, but in order to try to move this process along, I think it's better to have quality rather than quantity. And I must add, with all due respect to everyone involved, electronic cigarettes are heavily produced by tobacco companies. Now, the individuals in those companies, I'm sure, are fine people. But do I have to remind anyone that it was these corporations who for years and years denied the effects of cigarettes on individuals, and then for more years denied the effects of secondhand smoke until it literally smacked them right in the face. They're saying now, trust us, these products are safe even if they don't have proof. Well, I'm a pretty trusting person, but on this one, you got to give me real proof before I say that it's not necessary. And by the way, we're not blazing new ground here, Madam Chair. New York City, Chicago, Seattle, Boston, Indianapolis, Los Angeles, the state of New Jersey, and by the way, for all those who think this is just some liberal movement, those leftist bastions of North Dakota and Utah have passed legislation dealing with this issue that are very similar to what we have today. So I respectfully request that the committee moves this bill forward once they hear all the testimony. Thank you very much, Madam Chair.
Thank you very much for your comments. Are there any other comments from members of the committee? Thank you. We will begin our testimony with our commissioner. He will testify. All the witnesses who come to testify, because we have a large number of people who have requested to speak, you will be limited to 2 minutes. We don't need to eat the whole cow to know it's beef, so we will limit it to 2 minutes. Commissioner Schwartz.
Thank you, Madam Chairman. I am Donald Schwartz, the Health Commissioner for the City of Philadelphia. I want to begin by thanking not only the committee today, but particularly Councilman Greenlee for his leadership on this issue and his staff for their hard work. I appreciate having the chance to testify today on Bills 140095 and 140096. As the city's lead public health official and a pediatrician with over 25 years experience in caring for and about children, I believe that these two bills to ban cigarette sales to minors and to prohibit e-cigarette use in indoor places are reasonable and necessary to promote the public's health. E-cigarette use is growing rapidly, yet there is no, as we heard, federal regulation of their manufacture or content. Therefore, there's a great deal that we don't yet know about e-cigarettes. However, we know enough to take action locally, to take action now to assure that e-cigarettes do not cause harm. In fact, now is the best time to take action before e-cigarette exposure becomes more extensive. E-cigarettes generally consist of 3 parts as described in the legislation: a battery, a vaporizer or atomizer, and liquid usually containing nicotine and other chemicals. When an e-cigarette is used, the battery heats the liquid and turns that liquid into vapor. Then by inhaling, the vapor is delivered to the lungs, and in turn chemicals enter the bloodstream very quickly. Users also blow out vapor into the air around them. E-cigarettes come in many shapes and sizes, configurations. They look like cigarettes. Sometimes they look like cigars, hookah pipes, pens, and even computer USB drives. I have a few different kinds if the committee would like to inspect what some different kinds and brands look like. These products are called hookah pipes or vape pens by kids, and they're growing in popularity and availability, and the products themselves are changing rapidly. While e-cigarettes were initially sold only as complicated starter kits costing $50 to $100, they're now available on South Street and other places throughout Philadelphia in disposable form for $7 or less, particularly at convenience stores. One disposable e-cigarette can last as long as 2 packs of regular cigarettes. Over the past several years, e-cigarette use has doubled among adults and youth. It's reported that about 1 in 5 adult smokers and 7% of all of our youth have used e-cigarettes. Many believe this is an underestimate because of reporting. With some non-smoking youth using these products, we must be concerned that e-cigarettes are another way that kids are getting addicted to nicotine. The increased use of e-cigarettes has been in response to a surge of marketing. There have been Super Bowl TV ads, celebrity endorsements, and cartoon character promotions. E-cigarettes even come in candy flavors. I have some cherry flavored cigarettes here and vanilla flavored cigarette cartridges if people would like to smell them. The 3 major U.S. tobacco companies, as Councilman Greenlee mentioned, are now heavily invested in manufacture, sale, and advertising of e-cigarettes. In other words, the makers of Newport, Marlboro, and Camel are now all making their own e-cigarettes. Despite their dramatic growth, e-cigarettes are unregulated at the federal level. That means that the shampoo that your son or daughter or grandchild used this morning gets far more regulatory scrutiny than the e-cigarettes he or she may try this afternoon. E-cigarettes can be reformulated by companies without external oversight. The ingredients can vary widely from product to product, and the existing labeling is often inaccurate. For example, some e-cigarettes that are labeled as nicotine-free actually have nicotine in them. To protect e-cigarette users and those exposed to e-cigarette vapor, we believe that it is crucial for the FDA to regulate how these products are manufactured and labeled. Even then, the FDA won't address local sale and use, the issues that we're considering in these bills. As a result, we should not wait for federal action. We should act locally. For each of us, we need to ask, do we want our children or grandchildren to buy these products? Given that there's no control over the contents of these products, how do you or your family want to sit next to someone using an e-cigarette in a movie theater or a restaurant? Do we want pregnant women and children to breathe unregulated vapor from the person at a neighboring cubicle or table? Youth can currently go into stores all across Philadelphia and buy e-cigarettes. No ID, no asking of age, nothing. Bill 140096 prohibits sales to minors. It requires ID for purchase if the buyer looks to be younger than age 27 years. It sets fines of $250 for illegal sales to minors. These restrictions mirror those established for cigarettes by this council. Through this framework, we've been able to reduce cigarette sales to youth by 30% over the past 3 years. This bill will prevent kids from getting addicted to nicotine in e-cigarettes and possibly graduating to the use of deadly conventional cigarettes. It will also protect our youth from the potential harms of these products. The most common effects of e-cigarette use are cough and irritation in the mouth and throat. E-cigarettes can also negatively impact lung function after just 5 minutes of use. In addition, nicotine exposure increases heart rate and blood pressure and impairs circulation. In Philadelphia, we've reduced youth smoking by 40% with this council's active participation over the past 10 years. Let's not turn our backs on that progress. Bill 140095 restricts the use of e-cigarettes in indoor places. Let me be clear. We are not advocating the prohibition of e-cigarettes. Rather, we're advocating a sensible precautionary approach with respect to secondhand exposure. Studies have found e-cigarette vapor to contain nicotine in particular. In addition, heavy metals and even cancer-causing compounds. Instead of waiting for harms to be identified, though, it's the recommendation of our department that we should take a preventive and protective stance. Some businesses in Philadelphia have already prohibited indoor e-cigarette use through workplace policies, including the University of Pennsylvania. Thomas Jefferson University and the Philadelphia Airport are developing those policies, and Jefferson you'll hear from today. The Greater Philadelphia Business Coalition on Health, which has 35 large employer members with 350,000 employees and dependents, supports this policy. Across the country, companies like Walmart and Starbucks have already prohibited e-cigarette use indoors by staff and customers. So has the U.S. Air Force in their buildings and the U.S. Department of Transportation in its airplanes. In short, this isn't a radical notion. We believe setting a consistent citywide standard through legislation is critical. In the last several months, Los Angeles, Chicago, and New York have all passed laws prohibiting e-cigarette use indoors. Locally, we've heard from big and small businesses about situations in which people are caught off guard by a customer or an employee using an e-cigarette indoors. Managers, staff, and coworkers often don't know how to respond. They don't know the rules. Many wish they had guidance or direction. Most e-cigarettes are made to mimic regular cigarettes, as you see. They look and feel like regular cigarettes, and the vapor they release looks like smoke. This can lead to confusion that may negatively impact public health in several ways. First, it can make it difficult to enforce our existing laws regarding tobacco use indoors, particularly in crowded or dimly lit spaces. Imagine being a bar manager or club bouncer who has to determine whether cigarette smoke or e-cigarette vapor is coming from the other side of the room. Moreover, by allowing these cigarette-like products to be used indoors, we may make it seem more acceptable to smoke. This would be a huge loss for public health in Philadelphia. We've worked very hard for the gains that we've made. Clean air laws like the one established in Philadelphia in 2007 make smoking less visible and less acceptable. Along with other tobacco control strategies, the local smoke-free laws have driven down rates of smoking in Philadelphia by 15% since 2008. That means 42,000 fewer smokers in Philadelphia, and ultimately 20,000 fewer Philadelphians will die from tobacco-related causes. We need to keep that momentum going. One question commonly raised: don't e-cigarettes actually help people quit smoking? My first response is that these bills do not, and I'm going to highlight that, do not prevent adults from using these products for quitting if they so choose. They can use e-cigarettes at home or outdoors any time of the day. As I mentioned, the point is not prohibition, and as Councilman Greenlee put it, regulation, but only it is regulation, setting some clear rules about where e-cigarettes can and cannot be used. Second, while many users of e-cigarettes say they are using them to quit or cut down on regular cigarette use, real-world studies to date don't yet show them to be effective quit aids. Real-world studies. Individual stories can be compelling, and we acknowledge them, but the science just isn't there yet. One recently published national study of 2,800 smokers showed that those who used e-cigarettes were one-third less likely to quit successfully than smokers who did not use e-cigarettes. Many smokers are in fact dual users. That means they both smoke and use e-cigarettes. Without cutting down on smoking, this could increase their risk of harm from nicotine and other unregulated products in e-cigarette vapor. That said, e-cigarettes could eventually prove useful for helping some smokers to quit. We just don't know at this point how effective they will be or for whom. Even the blue brand e-cigarette package itself states, and I quote, "Electronic cigarettes are not a smoking cessation product and have not been evaluated by the FDA." Nevertheless, the e-cigarette industry is subtly marketing their products as quit aids, including featuring doctors in their advertising. Yet when the FDA tried to regulate e-cigarettes, when the FDA, federal agency, tried to regulate e-cigarettes as medication, drug delivery devices, a large e-cigarette company sued them and prevented that action. So this industry wants to generate huge sales by suggesting that their products can help people quit, but it doesn't want to have to do the studies to prove that the product is actually effective. You might ask, what's the alternative to regulating e-cigarettes as medications? In fact, it's to regulate them as tobacco products. That means implementing the types of policies that are being proposed in these two bills. We know from our work here in Philadelphia that the majority of our 280,000 smokers are desperate to quit. In fact, 9 out of 10 smokers regret ever having started in the first place. My message to smokers is that you can quit successfully. It might take multiple attempts, but you can do it. Don't give up. Here's some brief advice. Set a quit date. Tell family and friends and coworkers that you're quitting. Anticipate challenges of quitting and strategies for coping. Remove tobacco products, ashtrays, lighters, matches, and anything else that reminds you of smoking from your home, cars, or offices, that reminds you of cigarettes from. And talk to your doctor about medications that might help you quit. It's clear that smokers are more than twice as likely to quit for good if they quit with proven treatments, like counseling or nicotine replacement therapy. Any Philadelphia can call 1-800-QUIT-NOW, the quit line, to get a quit coach and up to 8 weeks of nicotine patches, gum, or lozenges mailed to their home for free. These medications have been carefully and rigorously studied and shown to be safe and effective, and they are regulated by the Food and Drug Administration. Philadelphians with Medicaid insurance pay only $1 per month for any approved cessation therapy, including nicotine inhalers. The FDA regulates those products, and they don't create a vapor. If you choose to use an e-cigarette to quit, get as much information as you can, talk to your doctor, try again through another approach. Philadelphians can also visit smokefreephilly.org, our website, for more information. In conclusion, the two proposed bills are reasonable, justifiable, and laudable approaches for protecting the public's health. Now is not the time to wait or hesitate. E-cigarette use is rising rapidly among youth and adults. We must ensure that these products are not used by children, that smoking-like behaviors are not glamorized, and the city has a consistent, enforceable approach to smoking and e-cigarette use indoors. And finally, that adults who choose not to use e-cigarettes can breathe vapor-free air. Thank you for your consideration. I'm happy to answer any questions.
Thank you very much. Chair recognizes Councilman Greenlee.
Thank you, Madam Chair. Basically, I just wanted to say, Dr. Schwartz, thank you, and to all your staff for all the work you've done on this. It really isn't any questions to ask very much from, you kind of covered everything, but I did want to emphasize the one issue about, excuse me, about the cessation factor, because I thought in the beginning that was one thing that I thought maybe merited some consideration, and I understand there will be people talking about that. But I think it is sort of important that you state that they didn't, the companies did not want to be called cessation, a cessation product, did not want the FDA to do that, and yet many of them are now saying, at least intimating, if not right out saying, that they can help you quit smoking. So it seems like that's fairly contradictory to me. Either you say you are or you're not, and it seems like we're getting those mixed messages. So, but again, I appreciate everything you have done and continue to do for the health of citizens of Philadelphia.
Thank you very much.
Thank you, Madam Chair.
Thank you very much. Are there any other questions or comments? Councilman O'Brien.
Commissioner, I'm just perusing a New York Times article, and it seems that the CDC took a survey, and it showed that 10% of high school students nationwide say they have tried e-cigarettes, double that of the year before. But none of these individuals who use hookah pipes and hookah pens, e-hookahs, and vapor pens consider them the same as e-cigarettes. Could you comment to me, that just seems like that's a clever marketing tool, and that these, and would you respond, are they covered, when we talk about the language, would they be covered under any other such products in this legislation?
They would if they're non-tobacco products, explicitly in this. Your confusion and the New York Times lack of clarity, I think, helps explain our particular concern about youth. So messaging for youth is less than clear. I can show you examples that will really chill you of ads for cigarettes and ads for new e-cigarettes, historic ads for cigarettes, and how similar they are to e-cigarette advertising. I have copies for the committee. It worries me that we have young people who aren't as able to discern differences, who aren't as able to figure out rules and regulations, and we have not yet in any way protected them or helped them not engage in this behavior. Yeah, all the products that you mentioned are covered by the law.
They would be covered
Yes,
under
they
our
would.
definition?
Yes.
That makes me feel good. And can you also, as I look at all these different pictures of these devices, they all look very similar. But there also seems to be a labeling issue. Some label states that there's nicotine content in, I'm looking at one, the King e-hookah. The label says this product contains nicotine, and later it says no nicotine. Have you come across those kinds of
You're
disparities?
seeing the same thing that we see. Remember, these are unregulated products. So there is no federal oversight. There is no federal standard of manufacture or sale.
And there can be a wide variation in the content of nicotine. Is that correct?
There can be complete variation. In addition, I should point out in terms of the indoor use regulation that the content of the cartridges that you saw, these are, in some cases, the cartridges are refillable. So people can fill them with their own liquid, which means that whatever studies, and they've been limited studies, have looked at what's contained in e-cigarettes and what the vapor from e-cigarettes might do in the general environment. That depends on having analyzed a limited number of products, liquid and vapor. What we have as a problem is the liquid can be filled by individuals and new products come onto the market constantly. So any study that's been done of a limited number of marketed products doesn't in any way take account of the fact that you could be sitting next to someone who filled their own e-cigarette with whatever they want, and you are now breathing in that vapor.
Can you make an analogy? I was involved in the tobacco settlement when that legislation was crafted in Harrisburg. Can you make any comparison to the issue of secondhand smoke as it relates to tobacco products and those of
So
e-cigarettes?
the answer to this, and I think you're going to hear from a researcher in Philadelphia who has looked at the limited amount of information that's out there on a limited number of e-cigarettes to figure out, based on the liquid and the vapor that would be produced by those e-cigarettes, would people sitting next to someone be exposed to high levels of carcinogens and other things. That study found, one, nicotine exposure, and two, exposure to what are thought of as the liquids, the glycol and propylene, the glycerin and propylene glycol that's in the major part of the liquid. And we don't know much about what that exposure is going to do either to the user or the person next to them. But it couldn't take account of newer brands. They weren't on the market when the study was done. It couldn't take account of anyone filling one of these cartridges with whatever they want. So sitting next to someone, we have no way to know, because we have no regulation, what we're breathing in. That's the concern of the department. The easy way to remove that risk is to not allow people to do it in indoor spaces where we're breathing each other's air.
Thank you.
Thank you.
Any other questions or comments? Thank you so much for your thoughtful testimony
Thank you.
and all the work that you're doing to keep us all healthy in Philadelphia.
Thank you.
Thank you very much, Dr.
Thank you for
Schwartz.
considering this.
Our next panel will be Dr. Walter Sue, Dr. Frank Leone, and Dr. James Plum.
Good afternoon, Chairwoman Tasco and members of the Committee on Public Health and Human Services. My name is Dr. Walter Tsu, and currently I serve as an adjunct professor at the University of Pennsylvania, and I had formerly served as Health Commissioner for Philadelphia during the early debate about restricting smoking in public places. In 2000, when proposals like smoke-free restaurants were first proposed, many restaurants opposed any government regulations with statements like, quote, "let the patrons decide," or "smokers will flock to the suburbs if we go smoke-free." Well, now 14 years later, the business objections have vanished. Verifiable billing receipts showed that restaurant businesses flourished under smoke-free laws. And today, the public would be offended, even outraged, if smoking were allowed back in public places. Businesses have found many benefits from the smoke-free laws, including increased revenue, lower cleaning costs, and healthier employees. Now enter a new threat to our public airspace, except instead of smoke, we have vapor coming from e-cigarettes. Commissioner Schwartz has broadly outlined the concerns that public health professionals have about e-cigarettes. And as he mentioned, businesses like Walmart and Starbucks and Penn have become proactive and have prohibited e-cigarettes in their premises. E-cigarette use is also prohibited on airplanes. For many reasons, the public, now accustomed to smoke-free laws, would be confused by making an exception for e-cigarettes. Business and building managers would be left to differentiate between products that mimic one another. The smell of the vapor from e-cigarettes would still be noticed, and vapor may cause cough and throat irritation, and the health effects of secondhand vapor exposure have not been fully studied. This is particularly challenging as e-cigarettes are unregulated, as mentioned before, at the federal level. Their contents are not clearly and accurately labeled, and the levels of chemicals can vary from product to product. For these reasons, major cities like New York, Chicago, and LA have included e-cigarettes in their smoke-free law, and those cities have held similar hearings to this one and heard the evidence on both sides, but in their judgment, common sense and consistency should prevail. In short, no smoke or flavored vapor should be allowed in public spaces. Clean air laws also have been a major contributor to convincing people to quit or not take up the habit. And by making it the law, we are making smoking or vaping a less visible or acceptable behavior. At a time when the federal government has also had almost no regulation of e-cigarettes, it's incumbent upon local cities and townships to lead. Finally, the tobacco industry owns major e-cigarette manufacturers and knows that adding nicotine to e-cigarettes can help addict the next generation of young smokers or vapors. The public demands action, and these common sense regulations are not a ban on e-cigarettes. I urge you to use the lessons from creating a smoke-free Philadelphia and keeping e-cigarette use out of public places and out of the hands of minors. Thank you for allowing me to testify. Thank you.
Thanks, Madam Chair, Tasco, members of the Committee on Public Health and Human Services. I'd like to thank you for the opportunity to present on these two bills. I believe that these two bills taken together really represent an important, a very reasonable and necessary step forward in your ongoing efforts to protect the public's health. My name is Frank Leone. I am the director of University of Pennsylvania's Comprehensive Smoking Treatment Program. But I've been in practice as a pulmonary physician in Philadelphia since 1997. Over the past 17 years, I've cared for thousands of Philadelphians suffering from tobacco dependence, which in my view is a disorder of the brain with a biology that is more complex than most people give it credit for. It's severely underestimated. My team and I have participated in research investigating a dozen different treatment strategies, including 2 current projects evaluating the potential of e-cigarettes as therapeutic devices. I'm most proud to say that I've been a vocal advocate on behalf of the people facing challenges of tobacco dependence. I serve on local, state, and national tobacco policy committees that sometimes wrestle with confusing and incomplete data for guidance. Throughout it all, I think of myself not as anti-smoking, but instead as strongly pro-smoker, working hard to ensure that the people with tobacco dependence are treated with dignity and respect that they deserve. It's actually from this perspective that I support these 2 bills. While it may be counterintuitive at first, I believe that your efforts to restrict accessibility to e-cigarettes are consistent with a pro-smoker advocacy position. I'd like to explain. Nicotine is a drug that is more capable of creating lifelong compulsion to continue its use than heroin or alcohol. The effects of nicotine on the brain are subtle but strong. Nicotine hijacks a person's most fundamental survival systems, creating a circumstance in which the presence of nicotine is experienced as safety, comfort, and security, while its absence is experienced as a visceral sense of uncertainty and insecurity. The paradox for tobacco-dependent people is the presence of 2 minds. Intellectually, people are very well aware that smoking is bad for them, but instinctively feel that nicotine is good to them. Quitting is hard not because it's complicated or because it's painful, but because it's often difficult for a person to imagine ways to run counter to the deep instincts in their soul. My patients experience this as a terrible situation. Imagine spending a lifetime stuck in a never-ending Hobson's choice, protecting your health only if you are able and willing to sacrifice your instinctive well-being. And if that isn't bad enough, imagine feeling stuck there while your family, friends, and coworkers look at you with disbelief and disgust. The impact of nicotine's effect on the brain are obdurate and do not resolve in days, weeks, or even months. For some folks, the rhythms of daily life represent a never-ending series of tripping points, reminders of the underlying attraction to the comfort of nicotine's embrace and the threats to the continued avoidance of smoking. It's no wonder then that tobacco dependence is characterized by people seeking the least worst compromise position. It's equally no wonder that people stuck in this position are vulnerable to emotional claims and the promises of safety. I imagine you will hear testimony today suggesting that e-cigarettes represent a potentially life-saving alternative to smoking. This actually may be true. I have no doubt that there are some people who will benefit from e-cigarette use. Unfortunately, I'm equally certain that there are people for whom the visible presence of e-cigarettes in their lives is an impediment to their healthy goals. My concern is that public, visible, unrestricted use of e-cigarettes may sufficiently stimulate or simulate the smoking behavior that, in the long run, it impedes a smoker's ability to abstain and increases an abstainer's likelihood of relapse. There is epidemiologic data supporting the notion that all 3 of those possible outcomes are actually happening simultaneously within populations. But there's insufficient data to know for sure that the benefits of unrestricted public e-cigarette use will outweigh the threat to the population's health. Until we know where the balance lies for Philadelphians as a whole, I would endorse any bill that seeks to keep e-cigarette use as a private and personal endeavor. The notion that e-cigarettes represent a potentially life-saving alternative to smoking is itself a non sequitur. This assertion would be true if the contention that the device saves lives was supported by evidence rather than by wishful thinking. On one hand, it is absolutely true that e-cigarette aerosols have been shown to contain much lower concentrations of carcinogens than tobacco smoke. It's also true that these aerosols do not seem to have long-term effect on lung function. However, propylene glycol, the constituent of e-cigarettes that produces the smoke-like suspension, is metabolized by the liver into an aldehyde, a class of compounds similar in structure to formaldehyde. For this reason, OSHA has set limits on acceptable levels of short-term exposure among workers in the theater industry and other contexts where propylene glycol is commonly employed. The FDA, in fact, does approve medications that use propylene glycol in their formulation. Doctors and nurses administer those medications every day. However, the benefits of the medications are accompanied by cautions to watch for sudden drops in blood pressure, cardiac rhythm problems, liver dysfunction, and buildup of blood acids. I want to be clear that I'm not saying that a few puffs off of an e-cigarette is likely to cause these problems. I would agree that's very unlikely. What I am saying is that the impact of long-term exposure to e-cigarette aerosols in an entire population remains unknown, and as such, in my view, remains a very legitimate cause for ongoing concern. Wouldn't it be an awful shame if we kept our eye exclusively on the potential for the e-cigarette to reduce the probability of lung cancer, while they were simultaneously, unknowingly, also raising the probability of other non-tobacco related illnesses? In my view, concern over safety remains a legitimate rationale for restricting the types of places where people may use e-cigarettes until some of these important questions have been reasonably answered. As you deliberate on the merits of these two bills, I would like to ask you to keep in mind that the fact there is currently no such thing as an e-cigarette. In the United States, there are currently over 400 brands of devices under the umbrella term of e-cigarette, each with its own proprietary formulation and characteristics. This fact should not suggest that we can never be secure in e-cigarette safety and efficacy. However, it is to suggest that current marketing models with ubiquitous access, few guidelines for use, enormous variability in product characteristics, and little product reliability or manufacturer accountability has the potential to distract smokers interested in harm reduction away from safe and effective methods for controlling the compulsion to smoke. Remember a time when we all thought it made perfect sense that filtered cigarettes and low-tar cigarettes just had to be safer than regular cigarettes. That is, until careful study showed them not to be. It's okay for the e-cigarette to occupy a hopeful position in our minds. What's not okay is for that hopefulness to overtake our security and the well-being of our friends and neighbors. We have 100 years experience with the disappointments of wishful thinking in the context of smoke exposure and smoking. Introducing a few straightforward minimum assurances is the right thing for City Council to do so that we as a community do not repeat the awful mistakes of the past while the truth about the impact of e-cigarettes on our lives makes itself apparent. Thank you.
Thank you very much. As I stated earlier, we have a long calendar here of people who are here to testify. So we ask you to please try and summarize your comments, particularly if some of the other witnesses have made the same comments. Thank you.
Yes, ma'am. Good afternoon, Chairman Tasco and members of the Committee on Public Health and Human Services. It's good to sit before you again. My name is Jim Plum, and I'm a professor in the Department of Family and Community Medicine and director of the Center for Urban Health at Jefferson. And I thank the committee for giving us an opportunity to provide testimony on the two bills in question. On behalf of the many patients and families, our faculty and our employees, let me thank each member of City Council for your many efforts on a wide range of issues to improve the quality of life for the citizens of our great city. We are proud of our strong linkage to the city through our patients, our families, and our 12,000 employees. We have over 47,000 hospital admissions and serve as a safety net hospital providing care to the city's most vulnerable citizens. We at Jefferson feel that it's crucial for Philadelphia's academic health centers and other large employers to take a lead in tobacco and e-cigarette policy. Jefferson is doing this. We have joined other healthcare institutions in taking steps to discourage smoking. That includes prohibiting smoking around the buildings on our campus effective July 1st, 2014. Jefferson's activities include high-profile community engagement with a vision to reduce health disparities through improved outcomes and quality of life. To that end, Jefferson has developed a 3-year community benefit plan to make this vision a reality, and a major component of that plan is to reduce smoking-related illness and death. To demonstrate the commitment to this strategy, Jefferson University and Hospital has developed a tobacco-free environment policy to promote the safety, health, and wellness of all patients, employees, volunteers, faculty members, medical staff, students, and vendors. Beginning in 2014 in July, all tobacco use is prohibited on the Jefferson campus. This policy applies to all patients, visitors, vendors, students, volunteers, medical staff, and employees within 50 feet of the entryway to or exit from any property owned, rented, or leased by Jefferson. These tobacco products and smoking materials refers to all smoke and tobacco products, including e-cigarettes. We are siding with our colleagues in public health that believe the jury is still out with respect to their use and the impact of secondhand vapors. Other reasons they are prohibited under our policy include the following. We are concerned that they could be a gateway to the use of other smoking devices such as cigarettes. We believe that allowing indoor use of e-cigarettes would make enforcement of existing smoking bans in and around buildings more challenging. And we believe that from a public health perspective, that cessation is the best solution, and we provide support for a number of resources to our employees. In short, we have banned the use of e-cigarettes in our policy and believe that indoor smoking bans should apply to e-cigarettes to best support public health. The City of Philadelphia has been a leader in the nation in reducing smoking rates through a variety of measures passed by City Council. And you have been involved in many of these efforts, not without opposition from multiple groups. The evidence of the real and potential harmful health effects of e-cigarettes has been well explained by my colleagues on these panels. And Jefferson has taken a strong and prudent stand on e-cigarette use. It is our obligation as an institution to protect the health and welfare of our family and of our patients. And I urge you to do the same for the Philadelphia family. Thank you.
Thank you very much. We appreciate your testimony. The one paragraph that you left out that I thought was most compelling.
Yes.
The hiring policy.
The hiring policy.
Yes.
We have elected, after much deliberation in our HR department, to have a non-smoking hiring policy beginning July 1st.
Very interesting. Very good. Thank you very much. Chair Wright, any questions? Councilman O'Brien?
I just have, I'm just haunted because in my previous life, when I was chairman of Health and Human Services in Harrisburg, I chaired the tobacco settlement conversations, and we put together the Joint State Government Commission, and all our academic health center partners were involved in those conversations. We had over 100
Yes.
of the CEOs, and unfortunately, I was talking to Commissioner Schwartz that that's under attack right now, the integrity of how we use that to bring investigators here to Pennsylvania. But what I'm really haunted by is I remember as we're going on the other side, the tobacco companies, and we're getting all these wonderful disclosures that were hidden, and tobacco companies hired the best researchers on the planet. And one of the issues, and I'm looking at all these hookahs and e-hookahs and e-cigarettes and all that kind of jiggle, and I remember that the tobacco companies knew that metaphysically, and I'm just paraphrasing this, that if a woman was smoking, that it would have an effect on their weight, maybe 5 to 7 pounds or something like that. And the tobacco companies specifically used that information to market Virginia Slims. I'm out of my mind, thinking that they're using those same marketing tactics right now, and that we are being exposed, and as you have adequately pointed out, our young people are going to be tricked into getting addicted to these harmful substances before the information and the data catches up. The other thing, and this is pure speculation, have you ever, I'm sure you've heard about the Manel Institute out at 35th and Market. They're an international center for sniffs and smells. And while I was putting some of my other discussions together on Health and Human Services, I used to go to senior citizens, and I'm a hugger, and my kids, you know, they use Old Spice and all these, and I get my face, my sinuses get clogged every morning, and it drives me crazy. I went out there, and they are an international center for sniffs and smells. I thought I was crazy. that I could be allergic to perfumes. That's what they do for a living. I'm wondering if you have ever looked into the possibility that the chemicals and the vapors that are contained in these hookahs and e-cigarettes, that aside from the obvious health concerns that we are discussing here today, if the simple allergic component is another health issue that we should be looking at. Do you have any thoughts on that?
I'm not aware of any data about the sort of specific allergic component of these aerosols.
I would just ask, perhaps we could ask our
Yeah.
wonderful friends at the Manel Institute, because that's what they do for a living.
Yeah.
Their biggest sponsors are the perfume companies around the world.
Yeah.
Because what they have to do is identify and document how someone is allergic to perfume so that they can market those products. But I'm just wondering, there's all kinds of chemicals that in other health discussions that we find are problematic, and maybe they are or not. I'm not going to get into some of my other issues where, certain chemicals have been related to issues, but I'm just wondering if that is an issue that we could pursue or just find some information about.
Absolutely. The people have actually pursued that question from the point of view of the particulate mass itself. So that in the aerosol, there's a lot of suspended particulates, and it's more of a sort of mechanical effect on airway function, nasal epithelial function, that sort of thing. But it's not really from the perspective of an allergic response, nor is it from the perspective strictly of odorants, rather from the perspective of the particulate mass in the vapor.
See, Bill, that's exactly what I was going to say, but he said it much better.
No, I have some students working with me this semester that I'm going to put on this particular question.
Thank you so much.
And we'll get back to you with what we can find. Thanks.
I'm most appreciative. Okay. Thank you.
Chair recognizes Councilman Greenlee.
Thank you, Madam Chair. I really don't have any questions for the panel, just except to say thank you, not just for being here, but all the work you do for the health of the citizens. I did want to put on record, though, Madam Chair, as I said in my opening statement, we could have more people here speaking, but we want to try to move this along. But if I just put on record that we do have support letters for these two bills from the American Academy of Pediatrics, the Greater Philadelphia Business Coalition on Health, the Kimmel Cancer Center at Thomas Jefferson, the Center for Public Health Initiatives at University of Pennsylvania, the Philadelphia Medical Society, professors of public health at Temple University, and just in today, Independence Blue Cross. So I think that's a pretty cross-section of health advocates in the city of Philadelphia. Thank you.
Thank you. Thank you very much. Thank you for taking time to come out to testify. Thank you. We appreciate it very much. Our next panel will be Dr. Joel Nitskin, R Street, Mr. Igor Bernstein, Mr. Tim McKinney, and Bill Gotchell.
Okay, Madam Chair, I've been advised that Mr. Burston had to leave because of, I guess, an airplane connection, so he will be unable to testify. I am Dr. Joel Nitskin. I'm a public health physician. I am here to present and discuss the public health case in favor of e-cigarettes and in opposition to the two bills in question. I've been assured by staff that not only my remarks, but a package of background materials has been shared with the committee members. Thank you for the opportunity to make this presentation. While strongly supporting in principle the banning of e-cigarette sales to minors, I find the wording of both of these bills harmful to the health of the public. My recommendations are the result of extensive research done first on behalf of the American Association of Public Health Physicians and later with support from the R Street Institute. This effort, begun in 2007, led us to the conclusion that a tobacco harm reduction initiative with e-cigarettes presents the only feasible policy option before us that would enable us to substantially reduce the number of smokers and the numbers of tobacco attributable deaths in the United States over the next 20 years. Despite the best of our tobacco control efforts, CDC estimates show that the numbers of smokers and numbers of smoking attributable deaths in the United States have remained essentially unchanged for the last 10 years. If we are to save the lives of current adult smokers, we will have to do something new. Now, I have been a local health director, a state health director, president of 2 national public health organizations, and I've been involved in tobacco control since the early 1980s. I'm not a company representative, and I'm not new to this game. Given the promise of e-cigarettes as a harm reduction modality and the inability of AAPHP, the organization that I first supported this efforts, to adequately support the research and advocacy needed to overcome resistance within the tobacco control community, I sought and secured outside support to enable me to continue this work and receive that support from the R Street Institute. R Street is a Washington-based libertarian think tank that respects the role of government to impose regulations to protect the health and environment while opposing what it considers to be excessive governmental interference in the marketplace. Neither I nor R Street is beholden to the tobacco or e-cigarette industries in any way. The opinions I present here today are entirely my own and do not represent any policy positions adopted by AAPHP, R Street, or any other organization I may be affiliated with. The bills before you appear to be the products of conservative forces within the tobacco control community who are unwilling to consider the possibility that any non-drug company product might have major public health benefits. They are unwilling to take a stance that might be in opposition to their partners and colleagues in the drug companies that so generously fund their research, annual meetings, and other activities. Despite the best of intentions, these bills, if adopted, will not protect or enhance the health of the public. They will not reduce teen smoking. They will not protect bystanders. They will convey the impression that e-cigarettes are as harmful or more harmful than traditional tobacco cigarettes. By doing so, they will protect the major cigarette makers and drug companies from competition from these more effective low-risk options. As to specific provisions in the 2 bills, 40095, defining e-cigarettes as smoking devices is a major distortion of the truth. The toxins created by tobacco combustion cause the potentially fatal heart disease, lung disease, cancer, and other diseases, and magnify the addictive potential of the nicotine. E-cigarette vapor contains no products of combustion and only the tiniest traces of other toxic substances. E-cigarettes pose a risk well below 2% the risk posed by regular cigarettes, and for all practical purposes, no risk to bystanders. E-cigarette fluid, we know what's in it. It contains nicotine, flavoring, propylene glycol, glycerin, and water. The lack of regulation by FDA is due to political and bureaucratic hang-ups within FDA that have nothing to do with e-cigarettes, and if anyone wants, I could enlarge on this in the question and answer period. The original CDC survey data referenced in these bills clearly show that the dramatic recent increases in e-cigarette use are almost entirely by current cigarette smokers, and that such use has been associated with reductions in smoking prevalence. Impressions to the contrary are entirely from press releases pulling data out of context to support these preconceived conclusions. The same is true of the other studies proponents of this bill quote to imply recruitment of teen non-smokers. Again, I'd be happy to elaborate on that if there's a desire to do so. Even with e-cigarettes designed to look like tobacco cigarettes, it is very easy for bystanders to tell the difference, even across the room. No evidence has been presented to date to suggest that e-cigarettes have eroded no smoking enforcement. The published evidence available to date, much of which is summarized in my handouts, shows that non-smoking teens and adults who experiment with e-cigarettes rarely continue their use. E-cigarettes are not intended to be a smoking cessation medication. They are intended to be long-term, low-risk substitutes for cigarettes. Again, if you'd like to discuss the issue of why the e-cigarette manufacturers opted not to be licensed as drugs, I'd be happy to go into that issue. Bill 40096, definition 1C, unapproved nicotine delivery product as worded is problematic. It would outlaw all non-pharmaceutical tobacco products since all such products deliver nicotine. It would outlaw chewing tobacco, cigarettes, all that. The FDA Center for Tobacco Products has yet to promulgate quality of manufacture regulations for any product subject to their jurisdiction. Thus, none have been approved or otherwise certified anywhere within the FDA to date. The issues addressed above for 40095 also apply to 40096. While I and other proponents of tobacco harm reduction support the prohibition of sale of nicotine delivery products to teens, this bill is so laced with problematic statements that I recommend that it be pulled from the council agenda and replaced with a better worded bill. It is important to note that the nicotine delivery products most accessible to teens are the FDA pharmaceutical patches, gums, lozenges, and inhalers on sale on open shelves in every drugstore, discount store, and most supermarkets, with the gum and lozenges available in a variety of fruit and candy flavors. If your real concern is stopping kids from initiating nicotine use, and you're not influenced or trying to support the pharmaceutical industry, I think this is an issue worthy of council attention. For some unspecified reason, neither the local tobacco control community nor either of these bills considers these products to be potential gateways for youth use of conventional cigarettes. I therefore urge that bills 40095 and 96 be pulled from the council agenda and that steps be taken to develop a new and properly worded bill to prohibit sales of e-cigarettes and other nicotine products to minors. Thank you.
Thank you very much.
Hi, I'm Bill Godshaw, founder and director of Smoke-Free Pennsylvania. Since 1990, we've advocated local, state, and federal policies to ban smoking in workplaces, stop cigarette marketing to youth, increase cigarette tax rates, hold cigarette companies accountable in civil court, and help smokers quit. During the past decade, we've been educating the public that cigarettes are 100 times more hazardous than all smoke-free tobacco nicotine alternatives, including smokeless tobacco, nicotine gums, lozenges, patches, inhalers, and electronic cigarettes. And we've been urging smokers who can't or aren't ready to quit all tobacco nicotine use to switch to these far less hazardous alternatives. After the FDA ban, for disclosure, neither Smoke-Free Pennsylvania nor I have ever received any funding from any tobacco, drug, or e-cigarette company, so we have no conflicts financially. After FDA banned all e-cigarette imports due to big pharmaceutical company lobbying, the agency revealed its unscientific, unethical, and inhumane policy by telling reporters, quote, "We don't want the public to perceive them as a safer alternative to cigarettes." And that underlying policy is shared by the people who are supporting this bill. They just don't want the public to know the facts or the truth. After customs agents seized their shipments in 2009, two e-cigarette companies sued the FDA, and Smoke-Free Pennsylvania collaborated with those companies in their litigation against the FDA. We filed an amicus brief with the D.C. Court of Appeals in 2010, which unanimously upheld Judge Leon's ruling that the FDA unlawfully banned e-cigarettes and provided no evidence of proof of any of their claims about the health claims. Since our goal is to reduce smoking, we urge this committee to reject both of these bills, because, especially the vaping ban, because it bans the use of these life-saving e-cigarettes, threatens the lives of vapors, discourages smokers from quitting, deceitfully defines smoke-free e-cigarettes as electronic smoking devices, imposes a $300 fine on employers and managers for not enforcing the law, which they can't enforce anyhow, which I'll get into later. It requires posting of signs that falsely claim e-cigarettes are smoking devices, And finally, I think this bill is preempted by our state Pennsylvania Clean Indoor Air Act, which specifically prohibits municipalities from enacting ordinances that are different than the state's smoking ban. In sharp contrast to the many false and misleading fear-mongering claims made by e-cigarette opponents, including this morning, this there right before us, since 2009, the scientific and empirical evidence during the past 5 years has consistently found that e-cigarettes are 99% less hazardous than cigarettes, plus or minus 1%. So the whole scientific debate is, are they 98% less hazardous or 99.99%? And it's all in that range. They've helped several million smokers quit, and several more millions sharply reduce their cigarette consumption, and they're consumed almost exclusively, about 99%, by cigarette smokers and by former smokers who switch to these products to quit. Public health benefits every time a smoker uses an e-cigarette instead of smoking. E-cigarettes have already replaced 1 billion packs of cigarettes in the United States in the past 5 years, and last year, U.S. cigarette consumption plummeted by 4.6% as e-cigarette sales skyrocketed. E-cigarettes are more effective for smoking cessation than FDA-approved gums, lozenges, patches, and inhalers, which have a 95% failure rate. They only help 1 out of 20 people who have used them quit smoking. The other 19 go back to cigarettes. And e-cigarettes pose fewer risks than FDA-approved Chantix, as Pfizer is facing hundreds of lawsuits for causing depression, suicides, and suicidal thoughts among their consumers. E-cigarettes pose no risk to non-users. Hundreds of common workplace and household products and activities emit far greater levels of indoor air pollution than e-cigarettes, including furniture, carpet, paint, printers, copiers, cooking, cleaning products, dry cleaning clothes, hairspray, perfume, nail polish, and even a cup of coffee. But we don't ban any of those things. Meanwhile, e-cigarettes have never been found to create daily dependence in any non-smoker anywhere in the world, and I challenge anybody to find one kid who became addicted to nicotine because of e-cigarettes. And they've never found to precede cigarettes use in any daily smoker. Although a CDC survey found that e-cigarette use doubled among teens from 2011 to 2012, smokers accounted for the overwhelming majority of these e-cigarette users. Among high school students, 7.6% of smokers and 0.4% of non-smokers reported past 30-day e-cigarette use in 2011, and that doubled for the next year to 15.7% of smokers and 0.7% of non-smokers. So less than 1 out of 100 non-smoking youth have ever tried an e-cigarette. Since CDC surveys found that teen smokers are at least 20 times more likely than non-smokers to report use of an e-cigarette, and found that teen smoking has declined every year since e-cigarettes have been marketed, e-cigarettes are a gateway away from, not towards, cigarette smoking for teens, just as they are for adults. Regardless, just as we don't ban adults from consuming alcohol, smokeless tobacco, coffee, or candy because some teens consume these products, it is absurd to ban e-cigarettes for that reason. E-cigarettes benefit many employers and management since workers don't waste company time on smoke breaks and customers don't disrupt businesses by going outside. Some employers actively encourage smokers to switch to e-cigarettes to improve employee health and save money, including health care costs. Besides, it's impossible to enforce vaping bans, and it's unfair to impose $300 fines on employers and businesses for violations, since e-cigarette users can eliminate all visible vapor by simply holding their breath for 2 seconds. And if you watch closely, I want all of you to see if you can tell if I'm using this e-cigarette or not. Nobody can tell. It's impossible to enforce, but you want to impose a $300 fine on any management for not being able to tell if I'm using an e-cigarette or not? That is absurd. Since 2009, Smoke-Free Pennsylvania has also advocated state laws banning the sale of e-cigarettes to minors, which 27 states have already enacted, and many more are in the process of enacting, including 4 laws passed in the past 2 weeks that have been sent to their governors. I just sent you last night, all of you, a copy of the most recent update of state and local legislation. It's about 13 pages long. Regarding the other bills, Bill number 96, we oppose the text of it because it appears to be preempted by the state law banning tobacco sales to minors, because it falsely defines smoke-free e-cigarettes as electronic smoking devices and creates a new derogatory category of unapproved nicotine delivery products to confuse and scare people, and because it requires all e-cigarette retailers to post enormous signs claiming that these are smoking devices when they're not. I urge this committee to amend Bill number 96 to make it consistent with the language, requirements, and penalties in Senator Tim Solobay's bill, which is Senate Bill 1055. I've sent it to a copy of to you, We also urge the Philadelphia City Council to support Tim Solovey's bill, which would ban the sale of all alternative nicotine products to minors in the state of Pennsylvania. And it also preempts the city ordinance anyhow, so even if you pass this ordinance, if Solovey's bill gets passed by the General Assembly, then this bill would be preempted by state law, and you'd have to go back and revisit this. So we'd ask you to make these consistent. Thank you very much.
Yeah, could I ask? Sure. Yeah, okay. Thank you, Madam Chair. Just a few things. I mean, I don't want to go on forever, but just a couple things. First of all, Dr. Niskin, somewhere in your comments you said about this bill, these two bills must be a result of a conservative element that for the pharmaceutical society, people. Is that something like that?
Conservative movement within the tobacco control community, which basically is most of the people in the tobacco control community. And basically, on their belief, they do not consider the possibility that any non-pharmaceutical product could have a public health benefit. So they approach it from that point of view. There can only be harm, no benefit, and everything else follows suit. There is a small but rapidly growing component of the public health community, myself, Mr. Godshall, others you may hear of, public health professionals, who are on that, who with independent review and no commitment or no support from the pharmaceutical industry, challenge that wisdom. As I noted, we have a problem. The numbers of smokers and numbers of deaths have not gone down in 10 years. We need something new, and this product offers a pathway. By invoking legislation that makes people believe that these are as bad as cigarettes or as harmful, you are preventing that potential public health benefit. That is the public health case against these bills.
Okay. First of all, and I say this kind of laughingly, I don't think I've ever been involved with anything that's been called conservative. Usually I'm called a bleeding heart liberal. So just for the record, I guess it, balances out something.
That's for all of us.
Oh, yeah, I guess. I don't know. And, you say that we're saying that is the same as cigarettes. I don't think there's anywhere that says that as tobacco. And we're not banning it. We're regulating it. And right now, there are no regulations. Am I correct to say there are no regulations on electronic cigarettes as we speak, federal regulations? Is that correct?
That is correct.
Okay.
But your regulations are supposedly intended to protect the health of the public. And the case that we're making is that there's a substantial amount of research that the prior speakers are either unfamiliar with or have chosen to ignore that address the very questions that you're talking about. Now, prohibition of sales of nicotine products to minors is a topic totally separate from banning e-cigarettes. That's another topic, and we fully support the banning of nicotine products to minors, but not with the wording of the bill in front of you.
Okay, and as far as the wording goes, and I don't want to get into a semantic argument. We can be here for a long time. But you said that it shouldn't be called smoking. Well, they're called electronic cigarettes. What do you do with cigarettes? You smoke, I guess some people eat them, but most people smoke them. And if you say, even what Mr. Godshall just did, if you puff on something, you inhale it, and at some point or another, exhale it, I think if you went out on the street and described that action to a man or woman walking up the street, say, what did we just do? I think they say we were smoking. So, why are we getting into this whole thing?
The reason we're getting...
Should this be regulated or not? But if we're going to get into, I think most people would call this smoking.
Yes, it should be regulated, but by presenting what e-cigarettes produce as smoke, you are distorting it. It is the toxins in the smoke that are not present in e-cigarette vapors that cause all of the potentially fatal illness, and also it is those toxic substances that so magnify the effect of the nicotine that people get addicted to cigarettes. They don't get addicted to e-cigarettes. That's a huge difference.
Okay, and I respect your opinion, and you certainly have it. There obviously are many, many other people, and I read the list, besides the witnesses today, a list of people, and I would certainly call them medical professionals who feel differently. Now, I don't know, maybe you'd say they're all in the pockets of the pharmaceutical society. I doubt that, but in any event, I appreciate your comments. Thank you.
I would like to respond to vaping. Water vapor is not smoke. And the people that are pushing this bill are trying to convince people that water vapor is smoke. I drove from Pittsburgh today. It was below zero when I left. I was emitting water vapor the whole time I breathed, but I wasn't smoking.
Were you puffing on something and inhaling it and exhaling it?
That has nothing to do with it. Smoke is smoke.
You say it
Vapor is
has nothing to-
vapor.
I'd say it
You're
does,
trying to
okay?
confuse everybody into believing that water vapor is smoke, and that's wrong. And water vapor doesn't harm people. It's not harmful, and you're trying to make it sound like it
And it
is as
says in-
hazardous as smoking.
What's in the water vapor?
Pardon?
What's in the water vapor that they're puffing on?
It's water vapor. It's when you breathe when it's cold out. It's
So
the
they're
same
just
thing.
inhaling water?
It's propylene glycol. You see it in entertainment, in rock concerts. I'm sure you've been there, nightclubs, except that it's about 1 million times greater concentrations of vapor than are emitted by an e-cigarette. It's just tiny. You're talking micrograms. It's barely detectable in microscopes, and they're trying to make it sound like it's as hazardous as smoke. Smoking kills people. Inhaling vapor doesn't.
We're not saying it's as hazardous. We're saying that there have been serious health professionals who have raised questions about it. And what we are saying is that until at least we get those questions answered by a neutral organization like the FDA or something like that, that at
FDA is
least,
not
hold
neutral.
on,
They
hold
banned the
on,
product in
hold on. Did I
2009.
interrupt you? Then don't interrupt me, please.
They're not neutral.
You don't interrupt me. Thank you. Now, when all we're saying is that we put in regulations on them. The word ban kept being used. We are not banning it. You can step outside. You can use it in your own home. You can sit in Love Park today if this bill was passed and use it. We are not banning it. So as long as we're playing semantics, gentlemen, I think we ought to make it clear that this is not a ban. It is a regulation of something that is, as we sit here today, is not regulated. Now, we can disagree on how much of a danger it is, but I think we can all say we can have difference of opinion, but the fact of the matter is we're not sure because we don't know all that's put in to these devices. So
Yes, we
I
do.
don't, well,
We do.
you think you do, I don't think we
The
do.
people that say we don't know are the people that either refuse to read the research. There's been over 200 studies published in the last 5 years on these products. I've sent them to most of these people. The Philadelphia Health Department's received copies of most of those. They refuse to read them. Instead, they come out and say, we don't know anything. There's no science. And the FDA called it a regulation in 2009 when they banned e-cigarettes. It's called code word for prohibition. Let's call it regulation. It sounds nice. They seized
Two
1,000
separate words.
shipments that customs agents did at U.S. ports, and that's what caused the two e-cigarette companies to sue FDA and win in federal court. I mean, you want to play games with words. Let's be honest.
I don't
now.
want to play games. I'm saying it directly what it is. I'm not playing games at all. I'm saying directly
Banning
what I
e-cigarette
feel it
use
is.
in every workplace in this city is effectively a ban, except you can go outside. So, I mean, why don't you ban coffee? It's got carcinogens in it, toxic chemicals.
I
Why don't
haven't
you
seen
ban
anybody
cooking-
inhale
cooking
it
in
and
every
put it out in the
workplace?
air.
Carpet. This carpet emits far more carcinogens than all the e-cigarettes combined in this country ever.
Is anybody smoking the carpet?
No, but they have carcinogens in it. You say you're worried about these unknown risks. Why don't you, we know about the risk of a lot of these other products. And you're not banning them, but you're suddenly banning this, even though
Thank you,
there's
sir.
no
Thank
evidence
you.
of
Thank you.
disease
We're not going
or
anywhere.
death
Thank you,
ever
sir.
caused
Thank
by
you.
this
Thank you.
product.
Thank you.
Okay. Thank you. I'd like to leave extra copies of my, okay.
I have a question. What was the number of that Senate bill?
Senate Bill 1055, Tim Soloway, he's a Democrat. And
Good. I know Tim. He's a good friend of mine, and I'm going to take you up on your invitation. I think I'm
Good,
going to
thank
call
you.
him, and I'm going to have a conversation with him. And if I can't dissuade him to amend the bill, perhaps I'll persuade some of his colleagues to have some creative amendments either in committee or on the floor.
You want Soloway to amend his bill to call these smoking devices?
I used to do that. I used to do the amendatory process very well in Harrisburg, and I may take you up on that offer and
No, I'm
and
saying you should support
looking into
Soloway's
Tim's.
bill
I
that
understand
bans
what you
sales
said.
of all-
Please don't be argumentative. Mr. or Doctor, can I ask you a question? I I'm speculating that you were way ahead of the curve in 2007 in doing research. And just for a point of clarity, were you doing research in other countries on e-cigarettes, or were you doing research in the United States for e-cigarettes that were in other countries? Because I understand that e-cigarettes were not introduced to the United States until 2010. So can you please tell me
Let me tell
where
you
your
what I was
research
doing and
was
why.
focused? And if I'm wrong, I would welcome some current research to dissuade me of the information that I have.
February of 2007 is the date the FDA law was introduced into Congress.
Am I correct that the e-cigarettes were not introduced until 2010? So I'm just wondering.
E-cigarettes
No.
were introduced in
Where you were-
2006 in the United States, and FDA seized 1,000
I-
shipments at U.S. ports in 2009 and 2010. So definitely, what you were told was inaccurate. That's why the e-cigarette company sued in May of 2009 the FDA, because FDA seized shipments. Most of these were made in China. They were shipped into U.S. ports. Customs agents were seizing them.
I was asking him a question. If you don't mind.
The research that we began in 2007 was on tobacco harm reduction on smokeless tobacco products. And then when e-cigarettes became more prominently available and visible, we added research on e-cigarettes to the work that we were doing. But the initial concept then and the concept now is one of tobacco harm reduction, enabling smokers who are unable or unwilling to quit to reduce their risk of potentially fatal illness by 98% or more by switching to a much lower risk product. Yeah, cessation is best, but it's not an option for many smokers. So the research we were doing was tobacco harm reduction.
Okay.
And
I
as-
thought you said it was e-cigarettes.
No.
And I thank you because I'm just infected as Mr. Greenlee is on the razzmatazz and merry-go-round. So
Chair recognizes Councilwoman.
I just have a clarifying question, and this is a yes or no answer. Is your assessment the same for these hookah, what did you call them, the hookah smoke stuff?
This assessment is the same for all electronic nicotine delivery systems, INS devices, which is the technically proper name for all of these.
Okay, thank you. And I'll just note for the record, notwithstanding the state bans, many times legislation flows up and many times it flows down. We will abide by the law, and then sometimes we pass laws and we get sued, and we're okay with that too. Thank you.
Thank you very much. Okay. You, Mr. McKinney?
Where you going?
Oh, you're the next panel. He wasn't with him. The next panel. Gilbert Ross, Medical and Executive Director of American Council on Science and Health. Carl Phillips, Consumer Advocates for Smoke-Free Alternatives Association, and Jeffrey Damon, Damon Associates. Good afternoon. Would you state your name for the record and begin your testimony?
My name is Carl B. Phillips, Ph.D. I am a former professor of public health and am now the scientific director for Consumer Advocates for Smoke-Free Alternatives Association, called CASA, the leading advocacy group for the millions of smokers who have quit smoking thanks to the use of low-risk alternatives. I lived here up until fairly recently, although a few months ago I moved out of state. CASA supports the prohibition of sales to e-cigarettes to minors in principle, although there are some fatal flaws with the wording of the current bill that have been pointed out. These are contained in my written testimony and are easier to follow there, so I will not waste time repeating those. We support the principle of the bill. It could easily be amended to fix the wording problems. Dr. Igor Burstin was hoping to be able to present here regarding the question of place bans on e-cigarette use. He is the world's leading expert on the health effects of the chemicals in e-cigarettes. He's a professor at Drexel University School of Public Health. Unfortunately, he was not able to be scheduled early enough and had to leave. To summarize what he would have been able to tell you in much greater detail, the environmental exposure from e-cigarettes is not at all similar to smoking. Professor Burston's recent review, which is a review of every available study about e-cigarettes, over 9,000 observations, including every single study that you have heard mentioned here today that suggested that there might be a risk, concluded that the exposure of chemicals to the user, both the intended ingredients and the contaminants, was far below the level that would create any health concern. That's to the user himself. The conclusion was that exposure to bystanders is 1,000 or 10,000 times less than the quantity which was already shown to be inconsequential. Therefore, the basis of this proposed ban, that there is some threat to bystanders, has absolutely no basis in science. You've heard other witnesses make hand-waving statements about, oh, we just don't know. But in fact, we have thousands upon thousands of observations. And the result is not that, oh, this just sneaks in below the level that we might consider hazardous. The result is that this is thousands of times lower than the level that would be considered hazardous. And as has already been noted by other witnesses, is far less than the exposure that you get from restaurant kitchens or furniture, someone peeling an orange, or simply a room full of people breathing, none of which I suspect you're planning on banning. And banning is a key word here. You have our written testimony from my organization, so I'd like to note that you've heard a remarkable number of claims from witnesses in support of this place ban, protesting frequently, oh, this isn't a ban. And yet, if you look at most of what they said, it had nothing to do with any issues about exposures to bystanders. It was all about reasons why those witnesses would like to ban e-cigarettes entirely. In addition, hundreds of statements that were made, literally over 100 statements there, were simply false. I could spend till midnight carefully debunking a lot of the scientific nonsense that you've heard here today, but I realize I'm not going to get an opportunity to do that. But set that aside, even if you believe most of what was said, most of them were attacks on the existence of e-cigarettes, not on allowing these products to be used because they are a public health miracle for smokers to quit smoking, but just we don't want other people exposed to them. The testimony had almost nothing at all to do with that. Vaping is about 99% less harmful than smoking, and hundreds of thousands of American smokers who would not have otherwise quit have switched to e-cigarettes, thus reducing their health risks almost as much as if they had quit cold turkey. Anything that discourages this switching is bad for public health. Now, you might be inclined to say, well, despite Igor Burston's definitive study, better safe than sorry. But this is not safe. This is very costly. Being able to use an e-cigarette in a bar or one's office rather than having to trudge outside to smoke is a big draw. People come for the convenience, but they stay for the 99% reduction in health risk. Take away that convenience, and you're going to be responsible for killing many people who would have quit smoking as a result of that, but instead figure that they might as well just keep smoking. This is hardly erring on the side of caution. The rest of my written testimony is on record. I just have to pause here and say that I think this is really sad. There was the remark about liberals and conservatives before. I'm about the strongest progressive liberal on most issues that you ever might want to find. And yet I'm one of the many people who has come to distrust and even hate government over actions like this. Basically, the argument was, we ban smoking, so yeah, let's go ahead and ban this too. But where does that leave us? This is Philadelphia. This isn't New York. This is Philadelphia, the cradle of liberty, the home of the Liberty Bell and Independence Hall. These get called public place bans, but this is not a public place ban for the most part. This would impose restrictions on 1 million private office managers, restaurateurs, and bar owners to not allow them to make the decision. You heard the testimony about various private actors who have decided on their own to not allow vaping on their private property. That's fine. That's their choice. But for the government to step in and override the judgment of a bar owner who thinks that it is perfectly acceptable to allow this, as far as we can tell, harmless activity to take place in their own space is a huge government overreach and the worst of the slippery slope arguments that you hear and that have caused so many people to lose their faith in government. So you're taking an action that dramatically restricts private choice based on misinformation when the correct information shows that there's no genuine risk here. I'm speaking for myself right now, not my organization, where I have to say that this is just a very sad thing for Philadelphia to be considering. Thank you.
Thank you very much. Any questions or comments? Oh, I'm sorry. Next.
Hi, I'm Dr. Gilbert Ross, Medical and Executive Director of the American Council on Science and Health. You have our printed position statement as well, I believe. ACTIA, which is our acronym, was founded in 1978, and we've been in the forefront of anti-smoking advocacy since then. We hate smoking. We love smokers, but we hate smoking. A few years ago, we became convinced, based upon evidence, that the best way out of smoking was with tobacco harm reduction, supplying nicotine addicts from cigarette smoke with the nicotine that they crave, but removing the carcinogens and toxins that are plentiful in cigarette smoke. But what people have been talking about here, all of those folks who testified in favor of these bills, kept repeating over and over again about the evils of smoking and how the tobacco companies and the cigarette makers deceived and manipulated ads and seduced kids into smoking and all of that. Well, yes, perhaps. I mean, that's certainly true. But e-cigarettes, the theme here seems to be conflating e-cigarettes with real cigarettes. They are not at all similar. Some of them look like cigarettes, and I think that generates the fear and loathing based upon the big tobacco tactics of the 20th century. But e-cigarettes are not cigarettes. There is no tobacco in e-cigarettes. There is no smoke associated with e-cigarettes, so to call them smoking devices is ridiculous. There's no combustion. The dangers of cigarette smoking, everybody here will agree, comes from the tar and gaseous phase that smokers inhale hundreds of times a day for hundreds of months and years, and that's what kills them. Smokers smoke for the nicotine, but they die from the smoke. So banning, restricting, and otherwise removing access from smokers to e-cigarettes, which seems to be a public health miracle based upon the information we have, is the opposite of public health. Nobody here has bothered to mention yet this following fact. We have 44 million approximate smokers in this country, two-thirds of whom at least are daily smokers, meaning they're addicted. 480,000 actually was the last CDC estimate of the number of Americans who die each year from cigarette smoke. 0 is the estimate of the number of people who have been sickened or killed by e-cigarettes, and yet you say we don't know what's in them. As Carl Phillips just testified, Igor Bertin is one of the world's experts on this subject, and it's a shame that the hearing was delayed sufficiently long such that he was unable to testify. But the vapor that e-cigarette users inhale has no threat to health, much less the threat from so-called secondhand vapor, which is a term that has, it's just nonsensical in terms of medical risk. People who say we need to regulate e-cigarettes, that they're not regulated, want basically to regulate them off the market. Again, as Carl said, it's really, in effect, a hatred of these devices because they remind people of cigarettes. they want to regulate them right off the market. We believe that regulation of e-cigarettes is a good thing in terms of age limits on marketing and sales, making sure that they're manufactured appropriately, responsibly, that the child-proof packaging and accurate labeling are all appropriate regulation. Also, people have said that there's no federal regulation. Well, the Family Smoking Prevention and Tobacco Control Act of 2009 is in effect a regulation to this extent. It's been also implied that e-cigarette companies are trying to kid the public that they're not really a smoking cessation device, that there's some other ulterior goal. E-cigarette companies are not permitted by that law to tell anybody that they can be used to stop smoking. It would be a violation of the law. So they have to go around the bend to try to imply that it might be healthier for you to use e-cigarettes than to smoke, which is obviously true, but they're not allowed to say that. It would be a violation of the law. We know for a fact. You say that there's no hard evidence that e-cigarettes lead to smoking cessation. We do know that millions and millions of units of these devices have been sold over the last couple of years, and sales seem to be doubling each year. At the same time, sales of cigarettes have declined by historic levels. Between 4 and 5% fewer cigarettes were sold last year than the year before. Also, there's some fear about teens being addicted to nicotine and becoming cigarette smokers thanks to e-cigarettes, and this ridiculous CDC report that was manipulated to scare people that e-cigarette use had been doubling among teens. Well, you heard the data from Mr. Gottschall about how phony those data were. In fact, teen smoking has declined significantly over the last couple of years, which flies in the face of the theory that e-cigarette use has anything to do with increasing the risk of teen smoking. That's another false alarm, red herring. Basically, e-cigarette vapor is steam, as Mr. Gottschall said, with some discussion about that. It contains nicotine and propylene glycol, or vegetable glycerin, and trace amounts of other chemicals. There's nothing in it that could harm anybody. I'd ask you, before you pass this bill, which is misguided, to think about the 480,000 Americans who die every year from cigarettes. E-cigarettes seem to be a way out of smoking, and to restrict them or reduce access to them is antithetical to public health. Please give it serious thought before you go ahead with this misguided measure. Thank you.
Thank you. Next.
Good afternoon and increasingly close to evening, Councilwoman Tasco and the rest of the committee. My name is Jeffrey Damon, and I do want to thank the City Council members for taking the time to think about the issues related to these personal electronic vaporizing units, such as have been labeled the electronic cigarettes. I think the good news is, by this point, many people have said most of even what I was going to say, and so while my written testimony has already been submitted, I will deviate, both in the hopes of being closer to the time limits imposed and just because most of this has already been said, and I think we are beginning to get a little bit weary. On that note, I want to thank the Council's exceptional staff for providing water to the table in light of the water vapor debate. I wasn't sure if they were trying to poison me, but I think the gesture is well intended. The problem I have, therefore, as we deviate from the testimony is, and as I've sat here and observed the committee hearing, is there's a lot of fear-mongering going on, and I was surprised to even hear that already brought up before I got to it. It's startling to me that we're discussing regulations where, with due respect, Councilman Greenlee, the justification is we don't understand it, we don't know that it's dangerous, but I guess we should regulate it. That seems to be a deviation from the political process that Councilwoman Quinones-Sanchez has eloquently pointed out. For Dr. Schwartz to say that, quote, the science just isn't there yet, at the same time to justify regulation, whereas also bemoaning the fact that we don't know what's going on, just seems to be a departure from the traditional legislative process, as surprisingly has already been mentioned by my panelist, Mr. Phillips. There are indeed many studies, and I worry that the way things have been presented today, that we just don't know, is on some level sticking one's head in the sand. It would be appropriate, I think, to regulate based on the evidence, and we too were going to mention Professor Burstein from Drexel University. He's somewhat local. I'm sure he'd be happy to follow up if the council, asked him. He has published studies, and the major conclusion of that study is that there is really no danger from secondhand vapor, if you want to call it that. Electronic cigarettes are not being targeted at our youth. We and the people we have spoken with do not oppose banning or regulating the sales of electronic cigarettes to youth, but as the other panelists before me have said, the promise is the way that this particular bill is drafted, and we would support it being amended to clarify what it does and what it does not apply to. The premise that vaping devices are dangerous is really the flawed issue with the second and more major regulatory move by the council. Whether or not it conflicts with the Commonwealth's own actions, as the councilwoman previously pointed out, is I guess ultimately a question for the courts. But I do just want to conclude by saying it seems odd to me that while we are promoting regulations, and Dr. Ross mentioned this before, we blame electronic vaping devices or cigarette manufacturers whom oftentimes have been purchased by tobacco companies but are rarely in fact developed by them. We blame them for not saying this is an electronic smoking cessation device when they're not allowed to do so. It seems again that we hide ourselves within the folds of political chicanery when we at once claim that we don't know what's going on but think that we have enough science upon which to base a regulation, and we fault people for not claiming that which it would be illegal for them to fault. So I guess I conclude with urging the council to consider the vast amount of evidence that does seem to be out there now and to propose and promote responsible regulation targeting sales to minors and to take into account the true science and the distinctions between vaping and actual tobacco cigarette use when promoting any further proposals. Thank you. We're losing the council.
Let me just ask you a question. What is the joy in using e-cigarettes?
What is the joy?
What's the joy? What's this, why people smoke them?
Well, honestly, I'll let others perhaps answer after me. I use neither. I believe the joy that people get is the health benefit that they perceive from having a far less dangerous, far lower content. The joy that they get is the ability to be able to use it in areas where it would be inappropriate to use tobacco products because of the impact and because that impact is really significantly lessened on other people. The access with which they have to use it, I believe, is another promoting factor. The convenience with which they use it is a promoting factor.
Well, do the e-cigarettes contain nicotine? What's in them?
Most e-cigarettes contain nicotine, but they don't have to. Some people that have quit smoking thanks to e-cigarettes have tapered down their nicotine level gradually to zero over the course of weeks, months, or even years. But many just enjoy the nicotine anyway without the toxins and carcinogens. A nicotine from an e-cigarette is not toxic. As a matter of fact, a nicotine in a regular cigarette is not toxic. Many people think that nicotine is a toxin or carcinogen. Even some physicians think so. That's false. Nicotine in a cigarette is an important part of the addictive quality of cigarette smoke, but nicotine per se is not toxic. I'm curious, though, as to why you asked, if you don't mind my asking, about the pleasure.
Well, I just want to know why people, because we've gotten some comments that I've stopped smoking and this helps me to continue to not to smoke. So it seems to me that there's something in the cigarette that's similar to in the e-cigarette that's similar to the regular cigarette.
I see your point.
It's a lower amount of nicotine. And so what is the joy in doing the
I'm going to
e-cigarette?
pass the mic on to the expert in that subject, Dr. Carl Phillips.
As both a scientific expert and as the only, as far as I know, nicotine user on the current panel, although there are certainly plenty in the room, I use nicotine because it is a wonderful cognitive enhancer. It makes my brain work better. This is true for an awful lot of people. It's very much like caffeine, and the analogy to caffeine continues beyond that. They are both relatively harmless, although neither one is perfectly harmless, but basically the risk is about the same. The effects are very similar. Some people, of course, become habitual users. I, for one, can take it or leave it. Some people are not in that fortunate situation and therefore find that the opportunity to use a low-risk form of nicotine, such as e-cigarettes or smokeless tobacco, allows them to not suffer the enormous difficulty of going from smoking to abstinence, but to still basically eliminate the health risks, in the range of 99% of all the health risks. And so those are some. There are a few other reasons why people like to use this. But the simplest possible answer that I think everybody can understand is for the same reason that people drink coffee.
I have only two very, very fast things to say. One, it hasn't been said yet, nobody wants anybody to take up nicotine who is not already on nicotine. E-cigarettes are for people who are addicted smokers to use them to quit. And second, people refer to evidence-based medications and methodologies to help smokers quit. The FDA-approved medications, including Zyban, bupropion, and Chantix, varenicline, and the patches and the gums, work rarely. Somebody did say that, but let me emphasize that. They work between 5 and 10% of the time, so that when you tell people, smokers, addicted smokers, over 50% of whom are going to die from smoking, to stick to the FDA-approved products, you're telling them to quit or die.
Well, they're going to die eventually.
That's a good point.
Yeah, thank you. And again, I'm not going to try to go too long here. I have to say, though, Dr. Ross, that's a total... To say that we're telling them to die, that's ridiculous. That's
can't hear you.
ridiculous. You said it was like telling them to die. That's ridiculous. And I really have a problem with statements like that.
The FDA-approved methods do not work, so when you tell an addicted smoker to use the quit lines and the FDA-approved methods and to not use e-cigarettes, as all the federal and even most of the local health agencies do, you warn them not to try e-cigarettes, stick to the FDA-approved products. What you're telling them is quit your addiction to nicotine, or else have an over 50% chance of dying from continuing to smoke. Maybe I should have phrased it that way.
Okay, all right, whatever. Let me just ask, I said in my opening statement that a lot of the producers of electronic cigarettes are the tobacco companies. Is that not an accurate statement? Or?
In my...
By far the majority of the producers are not the major tobacco companies. Electronic cigarettes were created, perfected, and popularized by companies that had no connection to the traditional tobacco industry at all. A few of those companies have now been acquired by tobacco companies. A few tobacco companies have started their own products. They were way behind the curve. They were way late in the game on this. They did not create this.
Okay. The reason I bring that up is that some of the strongest lobbying that's been done against this bill before today were by folks hired by the tobacco company. So that's the reason I raised that.
It's always been viewed as a threat to their market. So it was traditionally competitive, and as I'm sure the councilman recognizes, sometimes large companies acquire their competition, but it's always been viewed as a competitor to the market.
I lost that. Just say that one more time.
Electronic cigarettes, if we're going to call them that, have always been viewed by traditional tobacco products as a competitor to their market. So on some level, they've acquired some of those companies, as I'm sure the council is aware. Sometimes you acquire your competition, but they've always been viewed as a threat to the market because of the effectiveness of enabling people to stop using traditional products, and they were almost always developed outside of those companies.
But their lobbyists are now advocating against these bills, certainly against the regulation bill that I'm going to call it.
But any banning or restricting of e-cigarettes will have the effect of protecting cigarette markets and helping the big tobacco companies.
They are advocating against the bill, sir. They're advocating against the bill. So if it was going to help them, why wouldn't they want to see this bill go forward?
I frankly have no insight into that
All right.
topic.
Okay, let me ask this. The other two witnesses made a point of saying they had no connection with tobacco companies and their organization was not supported by tobacco companies. Will you three say the same thing? Mr. Ross, or Doctor, I'm sorry, is it Dr. Ross?
The American Council on Science and Health will accept no strings attached donations from anybody that will send us money.
Do you get support from tobacco companies?
Yes.
Okay.
CASA doesn't get any, has refused offers of support from traditional tobacco companies.
So you do not get support, but the American Council on Science and Health does, right?
Yes, and if you wish to perceive of the American Council on Science and Health as being a wholly owned subsidiary of a big tobacco company, feel free to do so. Nevertheless, everything I've said here remains true.
Okay. I didn't say anything. You just used the word subsidiary. I never used that word at all. I just asked a simple question.
I was being a reductio ad absurdum, but still all of the...
Being a what?
Reductio, meaning if whether we get 1% of our funding from tobacco companies or 99.8%, everything I said was still true.
Okay. It's your opinion. Whether it's true is obviously an argument, okay? And Ms. Damon, I think you're here as a...
We are not supported by
Right,
any tobacco
okay, all right,
companies.
that's fine.
It's a simple answer.
Okay, and let me just, in general, say, and I know people have used words like hate-mongering and all. I don't think we're doing any of the kind, and I could go on for a long time about that.
Fear-mongering.
Some of the things...
Fear-mongering.
Well, I think there was hate and then there was fear-mongering.
I think it was both fear. We're hopeful that Councilman O'Brien, who has professed expertise in amending bills, will be able to help bring these bills back to, a more specific and well-intended purpose, particularly the youth-directed bill.
Okay.
I'm focused on Tim Soliday's bill.
Yeah.
I'm sure the Commonwealth will look forward to your input.
Councilman O'Brien can speak for himself, but I think he told me he supports these bills, so...
But now I think he's going to hear reason from, I'm sure he's open to the constituency's testimony, and he'll try to improve it, because that's his legislative history.
You know what? I'm not interested in having you put words in my mouth. I'll make my own statements. Thank you very much.
I'm just referring to your previous
Madam
statement.
Chair.
Thank you very much. Next,
Thank you.
Thank you.
Chris Weber, Patrick Carroll, David Keller, and Chris Doney. I'm sorry if I mispronounced. Okay.
Good
Would you
afternoon.
state your name for the record, please, and proceed with your testimony?
Absolutely. Good afternoon, Madam Chairperson, members of the committee. My name is Christopher Pfeiffer, and I am here today as a resident of Mount Wolf, Pennsylvania, and a manager of a vape shop in York. I was also a smoker until 3 years ago when I discovered the wonders of vaping. Now, I get my nicotine craving satisfied without the nasty side effects of cigarette smoking. There are no longer butts littering the pavement outside the house, nor overflowing ashtrays emanating horrible, noxious odors. The best part is that I don't smell like a smoker anymore. My clothes, my car, my house, all free of tobacco smoke. For those who want to believe that secondhand vape is just as bad as secondhand smoke, go ahead and ask my girlfriend if she prefers the old days of having everything smelling like an ashtray or if she prefers the way things are now. In fact, early studies of the vapor emitted from a personal vaporizer then exhaled contains comparable amounts of pollution similar to normal outside air. I mentioned that I'm a manager of a vape shop here in Pennsylvania, and as far as I can tell, passing this bill as it is currently written would do wonders for business outside of Philadelphia, and possibly out of the great state of Pennsylvania. Our business used to be located in Glen Burnie, Maryland, but for reasons similar to why we are here today, the business owners decided to relocate to York, Pennsylvania. Passing of this bill will undoubtedly send plenty of vapors, new and old, out of Philadelphia to satisfy their desire. We would hope that they head over to our shop and experience a vape-friendly atmosphere where they can see what we have to offer, have the opportunity to try the myriad of different flavors that are available, and enjoy their device and their flavor at any number of vape-friendly establishments in our area. That's all I have. Thank you for your time, and vape on.
Next.
Hi, my name is Patrick Carroll. I'm a resident of Philadelphia, and I'm the co-founder of an electronic cigarette company called Jet Cigs. We're a Philadelphia company, though our office is located in Fulcroft, just over the border. But we're a Philadelphia company for tax purposes and all that. I'm a non-smoker.
You pay taxes in Philadelphia?
Yes.
You pay taxes in your Fallcroft?
No, here, Philadelphia. That's where our headquarters is, here in Philadelphia.
I misunderstood you. Forgive me.
I'm a non-smoker, but I became interested in this industry after doing a lot of research, and there has been a lot of scientific studies done on the effects of both e-cigs vapor and secondhand vapor. I'm a chemical engineer, and I've watched a lot of my coworkers and friends and such struggle with attempting to quit smoking and using the methods that are available, and wanted to see if I could become part of that, among other things. And I want to focus fairly narrowly on the issue of indoor air quality around e-cigs. There have been 3 or 4 studies done on this, all of which have determined no detectable toxic components of the vapor that a user exhales when using an electronic cigarette. What I feel is the best study, which is called Secondhand Exposure to Vapors from Electronic Cigarettes by Jan Shogala, found, this was actually referenced by Dr. Schwartz in his testimony, saying that there were detectable levels of nicotine found in the exhaled vapor of e-cigs. It's true that they were detectable. However, our abilities to detect things are pretty darn good in the science community these days. The levels which they detected were 0.8 to 6.2 micrograms per meter cubed, which is equivalent to parts per billion. I did a calculation of just how much nicotine a non-user, a person sitting next to a person vaping, could be expected to be exposed to from an e-cig based on these figures. And even at the high end of the range, after 8 hours, they would be exposed to the equivalent nicotine that's contained in 1 eggplant. There is nicotine in
1 eggplant?
Eggplant, yes. There's nicotine.
Some are pretty big.
That's true. I will allow that. I mean, this is an average eggplant. So, I do feel that there's a belief, and, as a non-smoker, I can appreciate this belief that nicotine is this terrifying chemical we need to avoid at all costs. But it is, at low levels, perfectly harmless, as far as I can tell, and as far as the people who regulate eggplants and their lack of warning labels can tell. And, other than nicotine, again, there are no detectable tar, minimal particulate levels, tobacco-specific nitrosamines, or any of the other components of cigarette smoke found in the exhaled vapor of an e-cig. And one reason why we might want to keep people who are trying to quit smoking indoors rather than sending them outside to smoke with people who are smoking cigarettes is that, a lot of cigarette smoking appears to me to be a social activity. So if a person who's trying to quit smoking is forced to go out there with the smokers, he or she is more likely to bum a cigarette from one of them and start smoking again. If they're able to stay inside and not go outside to use what they're using as an alternative to cigarettes, I think they're more likely to be able to quit. I suppose that's all I have to say. Thank you very much.
Thank you very much for your testimony. Our next witness, please.
Thank you, Councilwoman. My name is Chris Weber. I graduated from the University of Pennsylvania and lived in West Philadelphia for 5 years. Though I studied neurology and psychology at Penn, in addition to working at HUP in a brain imaging laboratory, I'm not here to talk about the science. I'm here to talk about my experiences as a former smoker. I was a smoker for almost 10 years, and now I'm thankfully quit thanks to vaping. And as a former smoker, I can actually address a question you brought up earlier. What is the joy? Why do people smoke? Smokers represent a community. I had tried to quit times and times again, and like this gentleman just mentioned, when you see smokers outside, you want to join them. I would see smokers congregating outside of bars or buildings, and that's where I felt comfortable. That was my community. As I'm sure we're all aware, because we've heard it so much today, tobacco is an incredibly hard habit to break. 95% of people who try fail. Furthermore, it's a huge public health issue. Almost 500,000 people die every year because of tobacco. We need a solution. Traditional nicotine replacement therapy has a success rate of, as was mentioned, about 7%. And, as we heard from proponents of the ban or regulation, people should stick to FDA-approved therapies like the patch or the gum or the lozenge, as well as therapy. Personally, I know a lot of people who just can't afford to pay thousands of dollars and spend hours every week in therapy, on top of spending hundreds of dollars a month on techniques that just don't work. The reality is, people smoke because life is hard, and they get a little bit of pleasure from smoking, and it gets them through their day. The problem is that it kills them. Vapor devices represent an incredible breakthrough because they allow smokers to get that pleasure, have that sense of community, but avoids almost all, if not all, of the health risks of tobacco. I understand my story is only one story, but there's quite a bit of research, in addition to anecdotal research, population-based studies that show between 22% and 88% of people who start vaping completely end their tobacco use. I know this is true, and there's actually quite a bit of research that I can send to you if you'd like. The reason why it's so effective is because vaping preserves that sense of community. It preserves the ritual of smoking while completely eliminating most, if not all, of the health risks. It's not a sneaky plan to renormalize smoking. It's a community that's trying not to kill itself. Like was mentioned before, this vaping came along well before tobacco industries got into it. This was a community that's really watching every other person die because of this habit, and then we're trying to stop that. I mean, it really is an attempt not to save our lives. As was mentioned by other people testifying, there really is no scientific basis for a ban, especially considering the fact that secondhand vapor has never been demonstrated to have any negative harm effects to bystanders. So that I ask you, you really have to consider when, considering this regulation, what the real effect is. You're going to be driving smokers back out to face their own personal devil, to be around other people using tobacco. And that really is going to harm a lot of people. And you have to ask yourself, why are you going to do this? Again, no scientific basis, and everything that I've heard today, at least, speaks to the fact that people just don't like the way it looks. They don't like the appearance of vapor being exhaled. Personally, I think when banning things that help a certain community just because of their appearances is bad public policy. And not only that, it's downright immoral. Banning things because of how they look is just wrong. I'd like to thank the council for this time.
Thank you very much. Next.
Hi, Council. Thank you for having me. My name is Dave Keller. I'm a proud resident of the Fairmont area of Philadelphia and also the co-owner of an online vapor store, Adirondack Vapor, that both specializes in the manufacture and sales of the liquids within vaporizers. I wanted to be very clear. I was a smoker, and I was a smoker for the better part of a decade. Pack a day, religiously, and there was absolutely no possibility, nothing I could do that would allow me to quit. I did go through the patches, the gum. I did Chantix with horrific side effects. I used all of the appropriate methodology in order to try and quit up until the point of actually hypnosis. The only thing that has worked for me in order to get me to quit is electronic cigarettes. So while there may be other speculation that they don't work because they're not FDA approved, I can tell you that myself and hundreds more like me that I've met in my travels would say to the contrary. Also in my experience, there have been establishments which I have used my personal vaporizer in. Usually it's with permission. Most of the time it's in social situations such as at bars and things of that nature. And for the most part, not only has this been a favorable thing for the bars in not having to regulate patrons going in and outside, but I can say for myself, at least a dozen people that I've met in that situation, I've converted to not smoking. Again, this is over a dozen people that no longer smoke because they were introduced to an electronic cigarette inside the walls of an establishment. What this bill here, as it's written, would effectively do is prevent that situation from occurring in the city of Philadelphia. Also, during my 10 years of vapor, I have become quite learned. I like to consider myself to be a lifetime learner, and my pedigree allows me to do this. Before coming into this realm, I was a clinical scientist. My title was actually clinical research associate. I worked in the research and development of pharmaceutical compounds. I've read the vast majority of the clinical studies associated with electronic cigarettes, and I can tell you with a straight face, that that actually there has never been one that I've read that the scientific methodology is well-founded enough to make any negative conclusions against the use of electronic cigarettes, both in primary user and secondary vapor. So basically I'm reiterating what many of my colleagues here have already said. There really isn't much of a basis behind why this bill is being introduced, and in fact, it will eventually be harmful in the fact that the availability to switch to electronic cigarettes will be very much limited by this bill. Thank you.
Thank you very much. Thank you for your testimony. Who's next?
Thank you.
Thank you. This is deja vu for us. Let me recognize Councilwoman Cindy Bass, who's a member of the committee who's joined us.
Thank you. My name is Chris Doney, and first off, I'd like to thank everyone for the opportunity to voice my opinions regarding this legislation. Now I could do like many other people have testified and explain how electronic cigarettes have changed my life, my health, etc. And it would be the same testimony you've heard from many others. I'd much rather spend the time discussing why we should embrace this vaping community and the e-cig industry while trying to avoid demonizing vaping and casting out those who are simply looking for a safer alternative to smoking tobacco. Now I ask you guys, why are vapers being targeted? I run a social club called the Vape Meet in the Allentown area. It's an opportunity for e-cig users and potential e-cig users to get together, enjoy the company of others. We have a few beers and laughs. We sample each other's and other vendors' e-liquids. We run giveaways and host classes on e-cig related topics. We are a tight-knit group, varying in age from mid-20s to into their 50s. And we probably would have never become acquainted if it weren't for electronic cigarettes. We host at a local diner and are all paying customers, providing that local business, an average of $300 to $500 extra on our meet nights. We are a respectful group. We are respectful of other diners. We don't get loud or obnoxious. And all the servers and managers appreciate our added business to them. All right. I bring this up because we vape indoors in a restaurant with other paying customers. But we do so with the permission of the establishment. And I myself have not heard of one single complaint come from our group, and we have never had anyone ask us to stop vaping or complain to a manager. Now, if a bill like 140095 were to pass in the Allentown area, we would be required to relocate our meetups back to a cigarette-infested bar, going home reeking of cigarettes and the very thing we are trying to get away from. Why force us outside to vape or back into a smoky bar when 95% of the e-cig users will ask the establishment if it allows vaping before using indoors and be very respectful of others' opinions? Why can't the business itself make up that own decision on e-cig use? This brings me to my next thought. What happens to those stores that carry e-cig equipment and e-liquid? If they're grouped in with the hookah lounges and bars, they need special permits and forms to allow vaping indoors, an unnecessary and damning blow to an infant of an industry. There are at least 5 vendors that I can think of in the Philadelphia area that provide stimulus for this waning economy, offering jobs and community outreach programs to help people get away from traditional tobacco. I've seen vendors donate time, money, and equipment to a program designated to help veterans and less fortunate people stop using cigarettes. So I ask you again, why are we criticizing a community that does a lot to help each other out, and even total strangers? I urge you to vote no on 140095 and keep vapors welcome in Philadelphia. Thank you.
And appreciate taking the time out to come. The next group would be Benjamin Daines, Suzanne Teresa, and Suzanne Parati. Then we have Gregory Conley and Dr. Robert Sclero. Are you here? Come up to the
doctor who opposed the usage ban had to leave for another hearing.
We'll just wait till you sit down and we'll ask you to testify, okay? Sir.
My name is Ben Daines, and I started smoking at the age
Sir, could you please speak into the microphone?
My
Thank
fault.
you very much.
My name is Ben Daines, and I started smoking at the age of 13. By my freshman year of college, I was smoking a pack and a half a day, and this was closer to 2 packs if I was drinking. Nearly 2 years ago, I bought an electronic cigarette after reading about them online, and within the first week, I stopped smoking tobacco cigarettes altogether. Electronic cigarettes are perhaps the first technological development that stands a very good chance of eliminating tobacco usage completely. In recent years, the portion of the U.S. population who smokes has stagnated, showing that the current methods of encouraging people to quit are no longer working. These are people who know full well the risks and adverse health effects that come with smoking, yet they choose to smoke anyway. Rather than continuing to push abstinence only in the form of quit or die, it may be time to embrace a harm reduction model. In fact, cigarette sales this year were down from last year compared to previous years, and I do not think it is a coincidence that the electronic cigarettes have gained huge popularity in the same year. The majority of harm that comes from smoking is from the smoke itself, not nicotine. Nicotine is not the Antichrist, and in fact, it carries about the same level of addiction, and its effects on the body and mind are very similar to that of caffeine. In fact, 2 drugs, one totally socially acceptable, I would venture to guess that most people in this room have had at least 1 cup of coffee today, and the other vilified by anti-smoking groups are very similar on the biochemical level. Because Quit or Die is showing that it has run its course and nicotine usage is not a major public health concern, it is time we encourage those who remain smokers to switch to vaping. We should be doing everything in our power to encourage them to switch to vaping, especially since smoking kills millions of Americans each year and is the #1 cause of preventable death in the nation. For this reason, electronic cigarettes should not be included in an existing indoor smoking bans. To include them would send the message to the general public that electronic cigarettes carry the same risks and adverse health effects as smoking does. This is simply not true. While it is a valid point that electronic cigarettes have not been around long enough to have long-term data on their effects, it can be said with great certainty that any potential risks involved with their use are many orders of magnitude less than those risks that we know tobacco cigarettes carry. To keep this information from the public or to perpetuate misinformation about electronic cigarettes is grossly irresponsible and will directly contribute to the deaths of many of your constituents. Furthermore, indoor smoking bans are accepted on the basis of the negative impact smoking has on the health of the smoker and those around them. These risks are not present with electronic cigarettes, and therefore there is no health or scientific basis for including electronic cigarettes in smoking bans. The sole reason for including them in smoking bans is one based on the ideological belief that it is wrong for people to appear to be smoking. However, as I have already discussed, this is silly and will only serve to dissuade many smokers from making the switch to relatively harmless vapor products. In fact, the ingredients in e-liquid or the nicotine solution used are, with the exception of nicotine and flavoring, the exact same chemicals used in commercial fog machines and asthma inhalers, which have been extensively studied and deemed safe to inhale. As a respectful adult, I understand that it is not appropriate to use my electronic cigarette everywhere I please, and for this reason I completely support individual establishments that choose to disallow vaping on their premises, but there is no need for a citywide ban on their usage. The vaping community is large and tight-knit. We support each other daily and is in some ways similar to the support found within the rooms of AA and NA. If our lives were not affected in an incredibly positive way, we would not be here today taking away time from our work and studies to speak to you on an issue that is very close to our hearts and our lungs for that matter. Also, while I fully support regulation that disallows the sale of electronic cigarettes to minors, I find the proposed signage highly questionable. The specific objection that I have is to the wordage labeling vapor products as electronic smoking devices. As previously stated, electronic cigarettes must not be associated with the evils of smoking in any way. Many of us are even opposed to them being called electronic cigarettes in the first place. Furthermore, it is misleading to refer to electronic cigarettes as unauthorized nicotine delivery products. It is simply unnecessary and even offensive. A much better proposed sign would say something along the lines of electronic nicotine devices, as that's what they are, a method of nicotine ingestion, not a device for smoking. We vape, we do not smoke. So for these reasons, I urge you to vote against the proposed bills 140096 and 140095. My council members, today you have the opportunity to stand in the way of the current trend of hanging smokers out to dry and vilifying these devices that stand a chance for the first time ever to do away with smoking. And I urge you to embrace this wonderful harm reduction solution. It would be hypocritical not to, especially in a city with one of the highest smoking rates in the country and a city that embraces harm reduction strategies when it comes to IV drug usage in the form of needle exchanges. Thank you.
We thank you for coming out this afternoon to testify, and though we may not always be on the same page, we appreciate all of you for taking time out to come to let your voices be heard, and we appreciate that. Thank you.
Thank you.
Next.
Chairwoman and distinguished members of the Philadelphia Health Committee, my name is Gregory Conley. 3.5 years ago, after trying and failing to quit smoking multiple times with the kinds of methods recommended by the Philadelphia Department of Health, the nicotine gum, lozenge, patch, etc., I finally managed to quit smoking with the use of a smoke-free, tobacco-free electronic cigarette. And I've spent the last 3.5 years trying to encourage state and local legislatures to embrace policies that recognize that electronic cigarettes and all smoke-free nicotine products, including the gum, patch, and lozenge, are all 98 to 99% less hazardous than smoking, and that none of these products should be banned, and it is a ban, by cities in places where smoking is banned. And I am here today, I should add, speaking on behalf of the National Vapors Club, a nonprofit that funds research on e-cigarettes as well as representing e-cigarette consumers. And I'm here as a volunteer. In regards to youth access, no one opposes banning the sale of electronic cigarettes to minors. On that note, it should be noted that the health commissioner in his testimony did not refer to electronic cigarettes as electronic smoking devices. Over and over again, he accurately called them by their most common name, electronic cigarettes or e-cigarettes. So why does this bill deceitfully refer to electronic cigarettes as electronic smoking devices? As pointed out by Bill Godshall in his testimony, if SB 1055 passes the Pennsylvania legislature, which it likely is, and it will not be amended to say electronic smoking devices, business owners will be required to post 2 signs in the city of Philadelphia. One sign mandated by the Pennsylvania government saying you can't sell alternative nicotine products, cigarettes and tobacco products to minors, and a whole separate sign from the Philadelphia Department of Health saying you can't sell cigarettes, tobacco products, electronic smoking devices, and whatever unapproved nicotine delivery products are to minors. This is utterly ridiculous. And for what? to falsely call a product that does not create smoking doesn't make sense. Additionally, the Commissioner of Health spent a lot of time talking about how individual businesses have banned e-cigarette use. This is exactly how policy on e-cigarette use should be set. Let's make it clear. Business owners are free to ban e-cigarette use, and all the people here today respect that. However, many businesses don't, particularly bars. In New York City, the Hospitality Association showed up and testified against the indoor usage ban because they wisely realized that when you have a lot of neighbors complaining that the drunks at your bar are outside smoking cigarettes and screaming and yelling at 2 o'clock, 3 o'clock in the morning, that it's vastly preferable to have people inside using an e-cigarette rather than outside smoking and littering. I'd also love to know what your enforcement plan is for this law. I mean, right outside the doors today, there are giant signs on every door saying no smoking within 20 feet of the door. Who was smoking 2 feet away from the door today? One of your security guards that's supposedly tasked with keeping people from smoking within 20 feet of the door. If you can't enforce your own smoke-free policy, how in the world do you expect to enforce an e-cigarette policy? Just to make a point, I sat in the back there and I put my device up to my lips about 20, 25 times during the course of this hearing. If this law passed, would one of those men in the back come up and tell me, sorry, even though you're not releasing visible vapor, even though we cannot tell if you are pressing the button and inhaling something, you have to stop? Am I going to be subject to a fine? And how in the world are you going to prove that in the court of law, that I actually use my electronic cigarette? Multiple jurisdictions have banned e-cigarette use where smoking's banned, and no ticket. There is no record of any enforcement in a bar, restaurant, office, etc. And meanwhile, being from New Jersey, where e-cigarette use has been banned, I can tell you confidently that e-cigarette use is rampant all around New Jersey. I proudly tell people when I meet them that our vapors, by the way, it's banned indoors, but 99% of the population is aware, and of the 1% that is, I don't know, maybe 0.1% actually would complain if they saw it. And as somebody who comes to Philadelphia about once a week, usually this time of year on cold winter nights, I have no plans to step outside into 10-degree weather to use this. I will just sit and I will puff and I will hold my breath and nothing will come out, and I'd love to be the test case in court. Most importantly, at a bare minimum, you should allow businesses to go through the same waiver process that businesses that allowed smoking were given when the Philadelphia City Council banned smoking in clubs and bars, I believe 10 years ago or less. It's not fair that you're giving a product that presents no risk to bystanders, or even by the admittance of the sponsor, less risk to bystanders. It is completely unfair that you gave more favorable treatment as a city council to bars and clubs that allowed cigarettes by allowing them to apply through a waiver process than you are for e-cigarettes. No bar, restaurant, office that wants to allow e-cigarette use will be allowed under this bill, but when you banned smoking, you did allow bars and clubs to apply for an exemption. So please, tell me why we can't enact that same process for bars and restaurants currently existing that wish to allow e-cigarette use in their establishment. And before I close, Councilman Greenlee, I interacted with you on Twitter last night, and I told you that when I spoke to you in person, I would say that you or the staff handling your Twitter account were 100% wrong when you stated that the passionate, dedicated e-cigarette users that were tweeting at you were, in your own words, paid spam bots. I keep my promises, so Councilman Greenlee, you were incorrect. Those are passionate people who care about vaping and care about saving people's lives by encouraging them to use a smoke-free product. So in conclusion, 10 years ago or however long when the city council banned smoking, you allowed bars and restaurants to apply for a waiver to continue to allow smoking. And now, when you're dealing with a product that creates no smoke, that you are planning on deceptively defining as smoking, you're not giving that process. So please, don't rush this bill out of committee. let it sit, let it simmer, and actually look at some of the science. And as for the youth access bill, please let that sit, even if only for a week, and fix the incorrect, misleading definitions that have no place in law. And I'd be happy to answer any questions. And I think it's unfortunate that I believe you're going to have someone from the Department of Health up and not have anyone to rebut anything that they're saying. But have a great day, and thank you for holding this hearing.
To rebut anything. Is there anybody else here to testify on this bill? Councilman Greenlee, I recognize you for comment.
Okay, just very quick as we wrap up here, just to clear up a few things that were said. First of all, the gentleman had the vape shop. According to this bill, if you have a vape shop, you still can vape in your establishment. So vape on, sir, if that's what you want to do. I just want to repeat, as I said many, many times, this is not a ban, and I'm not trying to play semantics. These are regulations, regulating a product that is not regulated at all now. Someone said about appearance, that we're mostly concerned about appearance. Maybe that was mentioned once. Most of us, the witnesses and myself, all said our main concern was that we do not know what's in this product. There's conflicting testimony about the potential harm, and all we're saying is that we're erring on the side of caution, and if people want to use this product, they should not do it in the public spaces. And we don't want people to smoke, and if this is the way they can quit smoking, we certainly say go ahead and do it. So we have never said, I don't think anybody, that we equate this with smoking. Our concern is that we don't know a lot about it. And I could go on, but I'm just, oh, and also if you have a waiver, if an establishment has a waiver to allow smoking, they're also allowed to use the electronic cigarettes in those places. And with that, Madam Chair, as we move to the meeting, I hope the committee sees fit to move these bills forward. Thank you very much.
Let me recognize Councilman Kenyatta Johnson, who's a member of this committee, and recognize Councilwoman Blondell Reynolds-Brown, who was at her seat. Are you on this committee?
No.
Who has come for the testimony.
Go into the meeting?
We've now adjourned our public hearing and go into the public meeting. I call on Councilman Greenlee to call up Bill 140095.
Okay, first of all, Madam Chair, I want to move an amendment to Bill number 140095. That amendment, which has been circulated, will make the effective date of this ordinance July 1st, 2014. And I move the adoption of that amendment.
Second. It has been moved and seconded that we accept the amendment for Bill 140095. All in favor?
Aye.
Is there any opposition? There being none, the amendment is passed. Now I call on Councilman Greenlee to call up Bill 140095 as amended to be reported out of the committee with a favorable recommendation.
Thank you. Yes.
And the rules, okay, go ahead.
Yeah, thank you, Madam Chair. I move that Bill number 140095 as amended be reported out as committee with a favorable recommendation, and the rules of council be suspended to allow for first reading at our next session of council.
Second. Thank you. It has been moved that Bill 140095 as amended be reported out of this committee with a favorable recommendation and a request for that council's rules be suspended so this bill can be placed on council's next session. All in favor?
Aye.
Is there any opposition? There being none, the bill is, motion is carried. Now I call on Councilman Greenlee for Bill 140096.
Thank you, Madam Chair. I move that Bill number 140096 be reported out of this committee with a favorable recommendation and that the rules of council be suspended to allow for first reading at our next session of council.
Second. It has been moved and properly seconded that Bill 140096, that we accept the amendment.
No amendment for that.
No, okay. I'm sorry. That Bill 140096 be reported out of committee with a favorable recommendation and that the rules be suspended so this bill can be heard at council's next session. All in favor?
Aye.
Is there any opposition? There being none, the bill motion's carried. Thank you very much. This bill will be called up in council's next session, and, thank you very much.